endoscopic approach, or ponytail facelift as it's commonly called. What is that technique? How is it done? What is the artistry behind it? What's your recovery like, and what sort of results can we expect? Let's try to hit all those points. The ponytail facelift came about years ago when surgeons started trying to minimize visible incisions. In other words, with a traditional facelift, typically there's a scar line that goes in front of the ear and behind the ear in order to remove excess skin that would otherwise bunch up there when the deeper layers are lifted and shaped. Endoscopic or ponytail facelift doesn't have these visible scars in front of the ear. In fact, we hide the scar lines behind the ears on both sides. We also place scars in the temple area, sometimes in the top of the scalp as well. Through those small incisions hidden behind the ears and in the temple hair, we then go through the outer layer of skin and fat, access what's called the deep layer, the deep plane, meaning the muscle fascia layer, and then release the ligaments that are holding our tissues on the bone structure. By releasing these ligaments, then we get mobility of these structures, and then we lift and shape the brows, the corner of the eye, lift the cheek tissues, as well as shaping the lower face and neck through these small hidden incisions. So that is essentially the ponytail lift. It's different from the traditional, I shouldn't use the word traditional because these are very sophisticated deep plane methods, but the method where skin is actually removed through a longer incision around the ear. Now, who's an optimal candidate for this ponytail facelift? It's those who don't have a lot of excess skin. If a patient comes in and he or she is 60, 65 years old and there's a lot of excess looseness of skin, well, that patient's probably going to need a deep plane facelift where there's skin removal through this longer incision, not a candidate for the endoscopic ponytail lift. So they tend to be at a younger age, 20s, 30s, who really want to look optimized, lifted, shaped, and they don't have excess skin to require the longer incisions. Now, where does the endoscopic piece come in? Well, an endoscope is a long telescopic video camera. So you imagine a thin telescope transmitting a video camera image to a TV screen where I make an incision here, I place my endoscope under the surface layers of tissue, and then I look on the TV screen, I can navigate all the structures of the face, release those ligaments that I was talking about in order to allow me to do the lift. That's the endoscope piece of it. Ponytail refers to when we put our faces, or if a woman puts her hair in a tight ponytail, they can sort of simulate this kind of lift. Now, if you see my before and afters, there is a representation of the artistry, and you really have to look at a lot of before and afters of the technique to see if the aesthetic resonates with you. For me, I'm not going for totally different identities here. Okay, this isn't face-off. This is about trying to reveal the most natural, most beautiful appearance that a person's anatomy can naturally give. So oftentimes that does mean lifting the outer brow, a slight bit at the corner of the eye. For example, if somebody's starting off with an eye shape like this, well, reversing that with a little canthoplasty brow lift. Mid-facelift, oftentimes I'm combining this incision approach with an internal inner upper lip incision to get access to that tunnel and lift the cheek tissue up. And then I'm sculpting the lower face under jawbone structures through a deep neck sculpting approach. That's going to give a really optimal improvement to patients with minimal scarring. Recovery is about the same as a deep plane facelift, so don't get the wrong idea about recovery where you think, oh, small incisions, therefore small recovery, big results. That's not how that works. Actually, the dissection is much more involved in an endoscopic ponytail lift as compared to deep plane facelift, and so the bruising, swelling, extended the period of recovery is about the same. 3-4 weeks to kind of transition to looking relatively normal, 6-8 weeks looking good, 6 months looking fantastic, 12 months looking amazing. Artistry, safety, technique, experience, all those are critical, and of course by a board-certified plastic surgeon who focuses on facial aesthetic surgery. Those are the key ingredients to finding the right person for you. Safety, always top-notch priority. I do surgery in a hospital-based operating facility with board-certified anesthesia teams and nursing teams, very experienced. There we have optimal safety. So that's endoscopic ponytail facelifting in a nutshell.